Hi, everyone, and welcome to the CAQH Core Town Hall. Thanks for joining us this afternoon. My name is Daphne Steriadis, and I'm an associate on the team. Just a quick recap, introduction to everything we'll be talking about today. We'll start off with an introduction to CAQH Core and our mission and vision. Then we'll go through a federal update. Following that, we'll have a spotlight where team members will talk about the advanced EOB guidance, our attachments pilot, and core certification. Following that overview, we'll get into some of CAQH Core's activities from this year, including our value-based payment initiatives, our healthcare claim work, and our electronic health record and practice management system environmental scan. We'll wrap things up with a Q&A. Some logistics for how this presentation will go. You can access all webinar materials from the handout section of the GoToWebinar menu on your right. You can also download the presentation slides and recording on our website after the webinar. Of course, a copy of the slides and the webinar recording will be emailed to all attendees and registrants in the next day. Questions can be submitted at any time using the questions panel on the GoToWebinar dashboard. With that, I will pass things over to Erin Weber.
Thanks, Daphne, and thanks everyone for joining us today. We have a lot of exciting material to share with you about the work that CAQH Core has been up to. Many of you know this year has been what we kind of call a research year for us. So back in January, February, the core participating organizations approved some major updates and new attachment operating rules. So that was a lot of work effort. And after we finish and approve a major set of rules, we typically go into a phase to identify what's next. So you'll hear from the team today about some of the research we're doing related to opportunities with healthcare claims, value-based payments, system integrations, as well as work we're doing to measure ROI and understand the value of the new and updated operating rules. But before we get into the details, I am going to give a quick overview of CAQH Core for those of you who may be new to the organization. CAQH Core is an initiative of CAQH. We have a membership of healthcare providers, plans, vendors, government entities, associations, standard setting organizations. Really any type of entity in healthcare is welcome to join us and participate in our operating rule development process. Our mission is to develop operating rules that build on and support standards in healthcare to accelerate interoperability and align systems to make data exchange easier. We are designated by the Department of Health and Human Services as the National Operating Rule Author for the HIPAA-covered administrative transactions. So we write operating rules for those transactions, but also touch on other standards in the industry from a voluntary perspective. And of course, CORE began as a voluntary effort way back in 2008. We are governed by a multi-stakeholder board, and we see our role not only to support and facilitate the development of industry-driven operating rules, but also to ensure there is industry awareness of those operating rules, adoption of those operating rules, and that those operating rules are having an impact on the industry. So we do a lot of education and outreach efforts like today's session. We have a certification program where organizations can demonstrate their conformance with the operating rules. And we have a measurement effort where we measure the ROI of the rules through pilots and in collaboration with our CAQH index product. On the next slide, I think we have a list of all of our core participating organizations. You can see they're quite representative of the healthcare industry. Hopefully your organization is on this list. If not, reach out to us. We'd love to have a conversation about how you can join us and share your expertise and industry insights into the development of operating rules to ensure that they are meeting the needs of all of our industry stakeholders. Next slide. To date, CORE has developed 8 sets of operating rules. 3 sets contain rules that are federally mandated under HIPAA. The rules really span the entire healthcare revenue cycle, beginning with that eligibility and benefits check when a patient first encounters a provider, all the way through payment and remittance processing, as well as some of those enrollment transactions and premium payment transactions to support members within plans. Next slide. So next, I'm going to give an update on some of the activities that are happening at a federal level that affect the work of our organizations that engage with CAQH Core, as well as talk about the process our board has launched to bring rules forward to HHS for potential federal mandate. So on the next slide, we have quite a few things going on in the industry these days, and not a lot of solid information on some of them in terms of timing, but I'm going to tell you what I can and what I know. First, I want to highlight that X12, the standard setting organization, has sent a letter to the National Committee on Vital and Health Statistics, which is an advisory body to HHS on administrative simplification issues related to HIPAA and other topics. They have proposed some updates to their standards, beginning with the remittance and claim transactions to update those standards from the current 5010 versions that are federally mandated. I believe there is a copy of the slides in the handout here, so you should be able to access the hyperlinks and see more information on each of these topics. We don't know yet when NCVHS is going to be holding a listening session on these rules, but that is the next, or on these standards, that is the next step in the process, and they will publish an announcement in the Federal Register in advance of that listening session, where they will solicit industry feedback. There are a couple things in proposed rulemaking. We know that the much awaited attachment standard proposed rule was received by OMB on August 2nd. So that is currently under review, but as we all know, the timing around this one has been very tricky. So, you know, more to come on when that rule might actually be put out for public comment. Also, the interoperability and prior authorization proposed rule is also scheduled for release potentially this fall. We know that there has been a lot of work done by stakeholders to implement components of the No Surprises Act. There was a third final rule released on August 19th and a set of FAQs to support with implementation there. We're going to talk about some of the work we're doing related to No Surprises Act in a few minutes as well. Related to the operating rules and the HIPAA administrative transactions, the CMS Office of the National Standards Group has released some new FAQs related to EFT and ERA, discussing the use of virtual credit cards, response requirements to the 835, and provider affiliation. And these are all topics that we have gotten a number of questions about over the years, so I encourage you to check out those FAQs. There is a new-ish task force meeting as a requirement of the 21st Century Cures Act, the Adopted Standards Task Force, and they are reviewing the currency of some existing standards and have reviewed more than 50 standards and will be making recommendations to the HITAC, the Health Information Technical Advisory Committee for ONC. Tomorrow there is a meeting about that. So if you're interested, I encourage you to check that out and their recommendations. CMS recently put out an RFI, I believe last week, seeking public input across really 4 broad domains, including patient access, provider experience, equity, and COVID-19 public health emergency waivers. Those comments are due by November 4th, so if your organization is interested in submitting feedback, it's more of a form fill on the website rather than a formal letter. They really wanted to make it user-friendly to get as much feedback as possible. Another topic that we are focused on at CORE is sending over some updates to ONC for their Interoperability Standards Advisory, or the ISA. The annual comment period is open until the end of this month to help support this resource. It's basically an online compendium of standards and operating rules and other tools to support interoperability in healthcare. That is available to the public. So we encourage you to take a look at that. And finally, ONC and HRSA are leveraging US CDI Plus to support their Uniform Data System Modernization Initiative. So that process is seeking to reduce reporting burden, improve data quality, and improve measurements within HRSA. So lots going on here. Certainly not enough time to discuss everything in a lot of detail. So we put a lot of hyperlinks in here for you to learn more information, and feel free to reach out to us if you have questions. Next, I'm going to talk about some of the work that CORE has been doing as part of our role as the National Operating Rule Authoring Entity. The CORE board recently decided to present a rule package containing both new and updated operating rules to that National Committee on Vital and Health Statistics for consideration for federal mandate, and that is really the first step in the regulatory process for operating rules. So we sent a letter on May 23rd, which is available on our website, and there's a link here with describing the rules and the rationale for bringing them forward. The next step will be similar to what I mentioned for those updated X12 standards, is that NCVHS will hold a listening session and request for public comment on those proposed operating rules. And then they'll finalize their recommendations to HHS based on that public feedback. So then should HHS decide to move forward with rulemaking, that would be the next step, and there would be a public comment period through that process as well. We do not yet know the date for that listening session, so stay tuned, and similarly that will be published in the Federal Register as we get closer. A little bit of information about the rules themselves that are included in the recommendations to NCVHS. Several updates were made to the core operating rules over the last couple years. In particular, some of the operating rules that are already federally mandated to align with industry best practices and immediate business need. A lot of these rules were developed 10 years ago now, so we've seen obviously a lot of change in the industry since then. So there are updates in there for the federally mandated infrastructure rules to increase system availability and connectivity and security requirements to meet modern day business practices. There is a proposed updated version of the core connectivity rule to provide enhanced security protocols and also support enabling both API and EDI data exchange, something we know is really critical for the industry right now. And lastly, the eligibility and benefits operating rules include some updates, including greater support for telehealth benefits information. Is a prior authorization required for this particular service, expanded service type and procedure codes, and patient attribution information for patients in value-based contracts. So all of those are new requirements and part of the core certification process, but also hopefully going to move forward as part of the federally mandated process as well. On the next slide, the board also put forward two new sets of operating rules that build on some of the existing operating rules for attachments or exchange of additional documentation for both prior authorization transactions and healthcare claim transactions. So there are infrastructure rules consistent with all of our other rule sets to support system availability, connectivity, file size requirements to create more common expectations for the exchange of this information, as well as data content rules that build on the infrastructure requirements with common code and data elements that can be used to support reassociation of that attachment with the prior authorization or the claim itself. I think it's worth noting that this is the first set of core operating rules that addresses multiple standards, as we know and are expecting that potential proposed rule for attachment standards to contain more than one standard. These rules support that framework and address key gaps that might not be defined by those potential standards. Next slide. So all that to say, it's a lot. There's a lot of information here, a lot of really good work that went into these rules. And I just want to highlight that these rules came out of about 1.5 to 2 years of work by those core participating organizations and the broader industry to identify where the greatest needs were, to provide input through the rule development process, which, as many of you know, is quite rigorous. We have a very strict approval processes with quorums and specific levels of support. And these rules, I will say, received unprecedented levels of support. Most had around 90% support from the participating organizations. And then the last stage is board approval, which these rules were unanimously approved. So lots of time and effort from the industry to develop and update these rules. And we thank you so much, particularly for those organizations that acted as co-chairs for these efforts. So just to summarize on this last slide, the board and the core participants feel really strongly, if we can move to the next slide, about the value that these updated and new attachment rules will bring to the industry. They really address unmet market needs that we have been hearing about repeatedly over the years, updating some of these outdated requirements and contributing to safe and effective patient care, making sure providers have information about the patients that will be beneficial at the time of service through that eligibility transaction, really facilitating the alignment of administrative and clinical activities with the inclusion of attachments and automating that process so it's not as costly and burdensome for stakeholders, and aligning standards and technologies to allow for consistent expectations, and talking again about the role of standard agnostic operating rules that can apply to different standards that are intended to have the same function, for example, for attachments. So helping ensure that those standards are operating with similar expectations. We know that demonstrating the value of these rules is really critical for the industry. So I'll just give an example here of what we have evaluated so far, and that is in this 2021 CAQH index, we saw a significant increase in the manual cost of that eligibility transaction. It was $15 in 2020, which is nearly double the cost in previous years. And this is a manual, pick up the phone and call the health plan to understand whether or not a patient is covered. And this was largely due to an increase in telehealth in 2020, as we all know, due to COVID. So including that telehealth benefit information and requiring that on the eligibility transaction will enable the industry to do this in a more automated fashion, thus reducing some of these higher costs. Another piece of work from the CAQH index on patient attribution found that providers are spending significant amounts of time, more than 3 hours sometimes, reviewing on understanding which patients are attributed to them. And 75% that participated in the index study here found that when they use the eligibility and benefits transaction to automate information and share information around attribution, they spent less than an hour exchanging this information. So we're talking about some significant time savings with automation for these rules. So again, we are at that point where we are working with NCBHS to identify time for a listening session. And once we have that, we'll certainly share that with industry and look forward to supporting that process as it moves forward. And now I'm going to turn it over. We have several folks from the core team here today to talk about some of the work that we are doing internally. And I will be turning it over now to Caitlin Powers, a senior associate, to talk about some of our no surprises work related to the advanced EOB requirements very specifically. Caitlin?
Thank you, Erin. And as Erin said, I'm Caitlin Powers. I'm a senior associate, and next we'll be talking about our advanced EOB guidance. Next slide. Thank you. So as we remember, last year, CAQH Core published recommendations on provider-to-payer approaches for good faith estimate exchanges. Given the nature of the current guidance published by CMS, we've really pivoted our work in this area to convening focus groups to engage industry in discussions, assess use cases, evaluate opportunity areas, and consider pilot projects. Our first focus group included 56 attendees from 31 organizations with the objective to understand industry status on approaches for implementing various components of the No Surprises Act, and also identify areas where CAQH Core can support implementation. Next slide. So when we're talking about the good faith estimate and the advanced EOB, this is how we're imagining the workflow to look like based on the current guidance published. So it would start with a patient scheduling an appointment or requesting a cost estimate. A convening provider facility would verify insurance. Right now, we see that being the co-provider gathering the estimates from all the, convening provider gathering estimates from co-providers and then sending the good faith estimate to the uninsured and self-pay patient. As it stands now, in the future, the current regulations suggest that the provider would send this good faith estimate to a health plan. The health plan would then send the advanced EOB to the member with possibly a copy to the provider. Next slide. So now let's look into the findings from our first focus group. Our participants noted that providers are much further along the implementation process for good faith estimates and advanced EOB requirements compared to health plans. So this is largely because providers were required to make GFEs available to all uninsured and self-pay patients beginning in January of this year, while there are no requirements for health plans yet. Next slide. Well, health plans are not far along in implementing No Surprises Act requirements. When asked if they are planning to implement a workflow to provide a copy of an advance EOB to providers, many said that they are waiting further guidance. And please note that this is not a requirement of the No Surprises Act, but providers have strongly indicated that sharing the advance EOB to them will be essential for the business. Next slide. And lastly, we asked our focus group which exchange methods they were considering to use, and over half plan to use a standards-based approach, such as the X12 837 professional and institutional determination, and the HL7 Divinity Price Cost Transparency Implementation Guide. And to follow up, our last slide, please. We are having a webinar in October. The date is to be announced on provider and vendor perspectives on current implementation approaches. CAQH Core will provide a regulatory landscape, and then we will learn from providers and vendors on their experiences supporting requirements this year. If you're interested in engaging in additional No Surprises Act work, you can reach out to X12, READY, and HL7. And as a final note, we are expecting guidance from CMS on further implementation requirements, hopefully this year. And that's all that we have for advanced EOB guidance. I'll now hand the call over to Taha to talk about our attachments. Thank you.
Thanks, Caitlin, for giving us an overview of CORE's work efforts around advanced EOBs to support the industry on the No Surprises Act. So as Caitlin mentioned, my name is Taha Anjawala. I'm Associate Director at CORE, and I'll spend the next several minutes talking about CORE's efforts to track value and adoption on our new attachment operating rules through our attachment pilot initiative. So on the next slide, our pilot initiative aims to use real-world testing and observation to measure and track the impact that operating rules and underlying standards have on an organization's efficiency metrics. Earlier this year, CORE launched pilot studies to understand the impact that the new CORE attachment operating rules that Erin mentioned earlier have on delivering ROI and streamlining workflows. We currently are engaged with several industry partners and have pilots underway on testing the impact of our new attachment rules. And all of our pilot projects aim to confirm if adoption of core rule requirements really support automation. Do they add value to existing and emerging standards or technology? And ultimately, the question, does the rules reduce administrative burden for providers and health plans? And there are four primary goals that we hope to achieve and serve as a foundation for our pilot's vision. The first goal is to align existing prior auth and claim operating rules and embed our new attachment operating rules on top of claim or prior authorization workflows to really test those automation efficiencies. The second goal is to work in concert with industry standards, whether it's existing or emerging, such as X12 or FHIR. Additionally, the third goal is that each pilot will identify opportunities to refine or enhance existing operating rules and potentially develop additional rule requirements if needed. And lastly, as pilot projects provide additional quantitative data and shed light on the value of operating rule requirements, these data points will help to quantify operating rules and what the impact would be when recommending rules to HHS for potential national implementation and adoption. If your organization is interested in joining CORE and its work efforts to quantify the impact that our attachment operating rules and industry standards have, there are two ways that you can engage in a pilot study with us. The first option is that CORE staff can work with your organization to build a pilot and measurement model based off an existing attachment automation project that you have in place or plan to work on as part of your strategic plan. And the second option is that if your organization is considering implementation of the new attachment operating rules and standards, but you may not have a program or pilot in place to date, CORE can work with your organization to build a pilot and measurement model from ground up. On the next slide, I'll talk about how CORE partners with and supports organizations throughout a pilot and measurement study. On the next slide, as organizations commit to engaging in a pilot study with CORE, there are a variety of touch points that aid to a successful partnership. As a first step, organizations interested in a pilot will agree to appoint an executive sponsor to the pilot project to ensure there's strategic and leadership support on the effort. Next, organizations will typically have to commit to 1 to 2 interviews with CORE staff so that we can understand what the current state and ideal state of attachment workflows are for your organization. Afterwards, organizations would need to provide a list of measurements that are tracked today and additional measurements that may be needed as in the future. And afterwards, and as needed, once a measurement model is established, organizations would need to participate in ongoing check-in calls to document observations, troubleshoot any sort of implementations or technical difficulties, and also work to highlight any progress with implementation and any efficiencies observed. As a benefit for engaging in a pilot study with CORE staff is able to provide support to organizations in a variety of ways. First, if your organization is having difficulty identifying trading partners who may have implemented attachment operating rules or standards such as the XL 275, CORE staff can help pair you with an organization to really undergo and test end-to-end implementations from a provider to a health plan and in the clearinghouse in between. Next, if CORE staff is available as technical resources to help organizations understand where operating rules and standards can be integrated into workflows and systems, and provide guidance where those standardizations could be beneficial. Further, CORE staff can help an organization develop a measurement approach, align on standardized metrics, and support organizations and data analysis to articulate what those key findings may be. So as you can see, CORE works hand in hand with organizations and based on available resources and efforts to support a successful pilot study. So on the next slide, I'll talk about the types of measurements that could be assessed and built as part of a pilot study or model to help showcase what those potential outcomes and quantifiable impacts that a pilot study could offer the industry for attachment operating rules. So in looking at and understanding the current landscape, it's important to establish key firmographic metrics such as, what is your total volume of claim attachments? How many staff are working on attachment requests, and what are total salaries of staff that have engaged in facilitating attachments, and from different modes, from electronic to manual methods. These firmographic metrics will really help to establish a base set of data so that these can be used as denominators for other key metrics. And looking at how implementation of attachment operating rules and standards may result in impactful changes, the following metrics could be designed. So this will be section number 2. So reduction in staff time spent on managing attachment requests. What are the reduction in errors or percent of error reduction, or improved time to final determination or claim adjudication? How fast does that change once you implement the attachment operating rules? As the pilot study concludes, big picture metrics can really then help to quantify impact and measure overall success. And those metrics could be designed such as, what is the overall time saved? What is ROI potential or projected annual savings? And looking at reduced time for patient care in the case of prior authorization attachments, or possibly looking at improved speed for claim payment for claim attachments. So as you can see, there are a variety of metrics that can be tracked, measured, and articulated, and CORE works with each partner organization to build off these measures, or to customize and build off what's needed for your organization. What are the key KPIs that your organization may want to track? As I mentioned earlier, these pilot studies really help shed the light on the value that operating rules and standards have to support automation, especially as there has been a lack of an attachment standard. These pilot studies could really support industry towards voluntary implementations, and those ROI measures, as those ROI measures are able to be articulated. Please reach out to CORE if you're interested in engaging or partnering with us on an attachment pilot. We'd be happy to have you. On the next slide, I'll now want to transition and talk about CORE certification. So I just talked about our pilot initiative, which is really designed to test new operating rules and really get what the ROI is for the industry. And now I'd like to transition and focus on CORE's effort to track industry adoption and implementation of mandated and industry recognized operating rules. So implementation of operating rules and standards really help to improve industry productivity, cut administrative costs, and advance interoperability initiatives. And as you can see on the slide, there are a wide array of organizations in the industry that really have demonstrated commitment to improve interoperability by implementing operating rules and supporting standards via our CORE certification program. And you can see there's a big list of health plans and vendors on this slide. So CORE certified health plans have a large impact on the industry and account for 70% of covered lives. And further, CORE certified vendors impact nearly half of all providers in the US. So thank you to all those organizations that have gone through the certification process and efforts to improve operational efficiencies in healthcare. On the next slide, so as operating rules are published, I want to kind of let us go and talk about the certification program. So CORE offers a certification and testing program to ensure that industry has successfully implemented operating rules and associated standards as defined by and required by regulations or trading partner agreements. And the certification program started back in 2007, as a way for CORE to support industry with implementation efforts. And the certification program validates and demonstrates its conformance to the rules that organizations implemented to ensure that their systems are up to date. The program was developed by industry for industry through a transparent and multi-stakeholder process similar to the process which the operating rules themselves were developed. And the program is really designed to ensure that IT systems and products are aligned with federally recognized and industry-developed operating rules and standards. To date, we've awarded 403 certifications, and we've had quite a lot of engagement from participation across various stakeholders. So you can see on the slide, there are several organizations that have achieved CORE certification or recertification in 2022. So thank you all for undergoing those efforts. And on the next slide, it's been a very busy year for the certification team, and I'd like to provide 2 key program updates for the industry to be aware of. First, I'm looking at the number of certifications and awarded or renewed since our last town hall in May. CORE has awarded 2 initial certifications and 11 recertifications across 7 organizations. We also have a number of additional organizations active in our pipeline that are expected to complete their certification or recertification testing by the end of the year. And the second key program update is that CORE is now actively working with our third-party testing vendor, Edifex, to update our certification testing platform to support some of the new operating rules and updates that were published earlier this year, including all the rules that Aaron talked about earlier in the presentation. So we hope to provide industry with updates and more definitive timelines on when certification testing for these rules. Hopefully we'll make that available soon. So next, I'd like to hand the call over to Mike Phillips, CORE Manager, to talk about some of the updates on some of our 2022 research activities. I'll hand the call over to Mike now.
Thanks, Taha, for that great overview, and thanks everyone for joining us today. I'm Mike Phillips, I'm a manager on the CAQH core team. I'm going to walk you through some of our activities related to value-based payment and healthcare claims. So beginning with value-based payment. Next slide, please, Stephanie. So CORE did some foundational work at this point about 4 years ago, identifying barriers to adoption and implementation of value-based payments and where efficiencies won in the fee-for-service environment could be used to standardize or make more uniform value-based payment models. The 5 operational areas that were identified at that time were data quality and uniformity, interoperability, patient risk stratification adjustment, provider attribution, and quality measurement. Each of these individual areas had issues with data standardization uniformity that effectively served as a barrier to implementation down the road. Now that we've gone about 4 years from that original publication, we're looking to evaluate new barriers or emerging issues that must be sort of understood in order to move forward. The 3 issues summarized briefly on the right here are health equity by design in value-based payment. So health equity has always been of utmost importance in healthcare, but since the COVID-19 pandemic has really been cast into the spotlight. Value-based payment programs are increasingly being designed to address health equity, and it's something that we need to understand how we can accommodate in future initiatives at CAQH Core. Secondly, on here is increasing program complexity and administration. Some might even call this increasing refinement of value-based payment programs. But as value-based payment models have evolved, contracting responsibilities and administration responsibilities after it has been implemented have become increasingly more complicated. I've already mentioned contracting. Another example of this is developing high-value networks where you can contain the healthcare dollar within a high-value network to ensure that patients are receiving high quality and the most bang for their buck, if you will. And then lastly, and I won't dwell on this too long, is value-based drug pricing. Increasingly, drug purchasing between suppliers, payers, and providers is being tied to outcomes-based models. And this is something that contextually we have to keep in mind as we seek solutions in the value-based payment space. All of this ultimately ties to the fact that CAQH Core is continually evaluating industry solutions that promote automation or justify the creation of new operating rules in support of VPP models and other initiatives. Next slide, please. So we're undertaking several activities related to value-based payment initiatives. The first one on this list is our comprehensive value-based payment environmental scan, which I personally have engaged with many of you on the call to speak about operational efficiencies in this space and understand more about the context so we can move forward in the most intelligent way possible. We're undertaking detailed research and expert stakeholder interviews, and we're really seeking to validate the relevance of the 5 opportunity areas and test the temperature, if you will, on the emerging areas to see where we might be able to take action. Related to this, we're evaluating the intersection of healthcare claims and value-based payments. I'll speak to the broader initiative around healthcare claims in just a moment, but one of the key areas of focus is value-based payments and how healthcare claims affects the implementation or barriers, if you will, to the implementation of value-based payments. And then lastly, a pending project is we want to take a look at the impact of the automation of CPT2 codes on value-based payment models. CPT2 codes are commonly used for quality or performance measurement in value-based payment models, but they are somewhat widely recognized as burdensome. They're no-pay codes, so they're just sort of added on to the claim, if you will. There are several vendors in the market right now seeking how to automate these claims. Automate the collection and documentation of CPT2 codes, and we want to work with those vendors to understand exactly what that impact is and what the ROI is. We're actively evaluating other pilot project opportunities, and we'll disseminate any future opportunities as they become available. Next slide, please, Stephanie. All right, and transitioning to our healthcare claims initiative. Next slide, please. So the thesis statement and the need, if you will, for our healthcare claims are, there are several emerging industry needs, and CAQH Core is identifying how healthcare claims need to respond to those needs. Right now, there are 7 operating rules that address the healthcare claims workflow. Together, these address submission, status inquiry, exchange of attachments, as well as payment and remittance. And new technologies, standards, and payment innovations, such as those found in value-based payment models, are disrupting the healthcare landscape. And as I said previously, this changes the context for and the role of healthcare claims. As Erin led off with, this is somewhat of a learning or a research year, and we're spending time identifying and addressing top priorities. Our team is undertaking research efforts to understand what the current industry needs are, and the results of these initiatives will inform the development of future operating rules. We're undertaking a stepwise process for this. So nearing conclusion is initiating our research-driven environmental scan. We're outlining opportunity areas using trusted resources such as industry journals, as well as industry interviews to make sure that we're filling in gaps and testing assumptions. We want to validate our findings from the first step and the proposed approach, and we're currently in the process of convening a focus group to confirm these findings and to solidify our direction for CAQH Core operating rule development. The invitation for that focus group went out broadly today, and we hope that you will join us on that group. And then lastly, we want to synthesize the information and disseminate it. We plan to release industry guidance at the end of this year, along with recommended next steps in advance of launching a healthcare claims subgroup, development subgroup in early 2023. So very exciting landscape for healthcare claims, and we're excited to move forward on this. On the next slide, I'll give you a little bit of detail on what topics we're initially focusing on. So the key areas of focus were identified by our CAQH Core participating organization in our last year's participant survey. And these are sort of our starting points of how we might develop operating rules in the claims space. These 5 areas are telehealth, value-based payments, patient data sharing, the translation or the support of translation from X12 to FHIR-based standards, as well as the 277 claims acknowledgement transaction. Overarching across all of this is the X12 recommendations to NCBHS to adopt the most current standards, their most current standards. We are beginning this look at version 8020 being one of the most current standards there, but just want to reiterate that the recommendation to NCBHS is that they adopt the most current standard, not just limited at version 8020. So a lot of work in the claims department, and we're very excited with the work we've done so far and to continue forward with it. From here, I'm going to pass on to my colleague, Mariana Singh.
Thanks, Mike, for that great overview on claims. As Mike mentioned, my name is Mariana Singh, and I'm a senior associate here at CORE, and I'll be reviewing our final topic for today, CORE's EHR and PMS initiative. On this next slide, you'll see a little bit of background vision in the process. So as many of you know, providers typically use 2 different systems or one with multiple functionalities to fulfill the patient care continuum. An electronic health record system, or what we will refer to as an EHR, is a system typically used to fulfill clinical needs, such as the storing of patient clinical information from progress notes, labs, images, etc. While a practice management system, which we will refer to as a PMS, is a system typically used to fulfill the administrative or more revenue cycle needs of a doctor's office or hospital, which would include your scheduling and billing. Traditionally, these two types of systems have been fragmented, meaning hospitals or doctor's office staffs needed to get information from different system sources, which often would result in delayed patient care and treatment. So CAQH Core plans to identify areas of opportunity within both the clinical and administrative workflows, which could benefit from integration of EHR and PMS systems. Utilizing an environmental scan approach, Core will explore the benefits and barriers to improved integration, as well as aim to identify opportunity areas for industry to align on common interoperability frameworks. The ultimate goal here is to understand how to reduce existing workflow burdens. Participation for this environmental scan is open to any organization. So if you're interested in participating, please do not hesitate to reach out to core at caqh.org. And the interviews and data collection is currently ongoing. In this next slide, I'll go more into details on the topics within integration that CAQH Core is exploring. So as mentioned, through this environmental scan, Core is looking at industry guidance to identify opportunities within both the clinical and administrative workflows, which could benefit from standardized integration of EHR and PMS systems. Core has conducted some interviews so far with the following topics within the patient care continuum emerging as prominent for exploration. So our first three topics listed here already have existing CAQH Core operating rules. These are the revenue cycle workflows such as eligibility and benefits verification, prior authorization, and claims adjudication. From the interviews so far, prior authorizations and appeals arose to the top as workflows that would benefit the most from better EHR PMS integration. In addition, Core is looking into how integration could help VBP workflows, as well as the exchange of additional documentation, or what we refer to as attachments. Our other two topics that you can see listed here on the right include standards and technology, as well as integration with external stakeholders. So standards and technology includes looking into codes, as well as emerging technologies such as APIs, and how integration or interoperability utilizing these technologies and various standards could help streamline workflows. Integration with external stakeholders means looking into the data, standard, or system needs for proper interaction with external stakeholders such as health plans, government agencies, laboratories, or pharmacies, which we saw a lot of need for through the COVID pandemic. Our last three topics are newer areas for Core exploration, which include telehealth, price transparency, and patient data sharing. From our interviews so far, and as Aaron mentioned earlier, there's vast variances among telehealth platforms and the need for integration on both a clinical perspective to conduct those appointments, as well as administrative to bill to get those appointments paid for. Our second topic here with price transparency, which Caitlin spoke to a little bit earlier, we know is a hot topic with the No Surprises Act. Through this initiative, Core wants to learn from industry how system interoperability and/or integration could assist with the population of patient financial information for good faith estimates. Sharing that same sentiment of our last topic is patient data sharing. Core is looking into how better system integration of EHRs or PMS systems could assist in reducing workflows when sharing information to patients, whether that's utilizing the same EHR or if providers currently have a separate portal or using direct messaging in which they use to share information to patients. So this kind of just captures a summary of the subtopics within integration that Core is looking into. So if you're interested in participating or have some insights into these, please don't hesitate to reach out to Core. And I'll now hand it over to Daphne to hit us with the polling question.
Thanks, Mariana. Before I go ahead and launch the polling question, I want to remind our audience that we'll be going into Q&A. So if you have any questions, please feel free to drop them in the chat for our speakers to address. So with that, we'll launch this polling question. Given that we have a lot of different exciting initiatives, we would like to hear from you in what areas you'd like to engage with us. So please select all that apply. The first is the EHR PMS integration environmental scan. and we have the value-based payment environmental scan listed, healthcare claims data content opportunity area research, and the attachments pilot and measurement study. Our team will follow up and give you any additional information you might need. All right, thank you all for contributing. With that, we will go into our Q&A. So this first question has to do with the No Surprises Act. So in light of forthcoming guidance related to requirements, does CORE anticipate any updates or developments to code combinations or new operating rules?
Thanks, Stephanie. That's a great question. I think most broadly from an operating rule perspective, I think the industry is still thinking through what are the standards that work for these workflows. These aren't traditional workflows, so there's a lot of work going on, as Caitlin mentioned, at X12, HL7, and DaVinci to think through how can we use existing standards or emerging standards to help meet some of the goals of the No Surprises Act requirements, and then there'll be potentially some opportunity for operating rules. But given operating rules build on standards, we're tracking and supporting industry as they go through that process first. We have heard from stakeholders also that there may be some needs around the denial and adjustment codes in the 835, and that is something that our team is actively researching and may be an opportunity related to the uniform use of Parks and Recs operating rules. So stay tuned for more information.
Thanks, Erin. And to that end, going back to the EHR PMS environmental scan, what is the vision for this initiative? Especially as Mariana mentioned, it seems like there is a lot of interest around areas where there's existing core operating rules. She mentioned VBP attachments, revenue cycle workflows, and so on. What is the final product, or what is the core vision here?
Yeah, that's a good question. So this topic came every year. We do an annual CORE participant survey where we survey our participating organizations for their priorities for CORE for the upcoming year. And so this came out of the 2021 survey. We just completed the 2022 survey and are analyzing that data now. So right now, as I mentioned, this is a really focused research time for us. So that team is interviewing stakeholders and trying to understand where there are gaps to support that EHR PMS integration. I suspect that one product coming out of it may be an issue brief or a white paper summarizing the lessons learned. But this is an area that is really informing some of the other topics that CORE is working on. As you mentioned, it really builds on some of the value-based work and the healthcare claims work and other topics. So I think the findings from this research will really inform some of the other areas where we'll go deeper, potentially from an operating role perspective.
And Erin, you mentioned the participant survey. Are you seeing any priority areas or topics already rising to the top in terms of focus areas for CORE in 2023?
Well, I think some of the most obvious areas are the ones we talked about today that are really building off of the findings from the 2021 survey. So value-based payments, certainly some of the topics that Mike focused on, healthcare claims. One of the areas we've been talking about as well is the EFT and ERA enrollment operating rules. So those are federally mandated rules that were developed, again, probably about 10 years ago. And we know provider enrollment processes have changed, fraud and abuse has become a larger issue. So thinking through security and those types of things, that may be something that we also revisit in 2023, along with some interest in continuing to support and educate and provide guidance on some of the price transparency efforts occurring in the industry.
Thanks, Erin. And I'm seeing a question about upcoming webinars. We will send out all of that information as soon as it's scheduled. So everyone in the audience should receive an email with the registration links for the October webinar that Caitlin mentioned around provider vendor perspectives. I also do want to note that we have an exciting webinar on November 3rd with one of our board members, Margaret Schuler. So stay tuned for all of that. Before we close out our session today, I want to present you all with a brief call to action. Please feel free to reach out to us if you have any interest in participating in any of our pilot or ROI work. Of course, we would love for you to engage with us as a CAQH core participant, and then of course become core certified. If you have any questions regarding any of those activities, please feel free to reach out to the core team at core@caqh.org. Big thank you to all of our speakers today. And thank you, of course, to our audience for joining us. I hope everyone has a great afternoon.